Maybe an MRI has shown that all your carotid artery is very narrow inside. It's very narrow because of an excessive buildup of plaque. Then a potential treatment is to undergo Welcome to Day Spring Life and Health Channel. This is Dr. Otini coming to you again. Today we're going to talk about the treatment of a TIA, Transient Ischemic Attack. How do we treat a mini stroke? What are the goals of treatment? I've outlined three goals of treatment. Anyway, if you haven't seen our videos about what a TIA is, or the difference between a TIA or a mini stroke and a full-blown stroke, check our channel. Maybe here it will make more sense when you watch it before you watch this, or even after this. Just check those videos out so that you can get a full understanding of what is going on here. So the first goal is to prevent the build-up of plaque, to prevent the build-up of fatty deposits in your arteries. The second goal of treatment is, are we even able to remove plaque? Can we remove plaque? If plaque buildup especially in the carotid artery is one that is leading to the disruptions of blood supply to the brain and leading to a TIA or a mini stroke, then one goal is to potentially remove the plaque or the fatty deposits in the carotid arteries and any arteries that are causing that. And the last goal is to prevent clots from happening in the first place. So if clots do happen, a TIA is possible and potentially a full-blown stroke. So let's hit on the treatment proper. The first one, according to the first goal that we wanted to talk about, the first goal is to prevent plaque buildup in our arteries. So then if we want to treat a TIA, what we want to do is to use a cholesterol-lowering drug. Typically the statins, the atorvastatins, the rosuvastatins, the lovastatins, the simvastatins, and the pitavastatin. Anywhere you are, whatever statins you are used to, they basically decrease your body's production of cholesterol, typically the bad cholesterol. So that is how they work. And it is also up in this, some studies have also shown that not only did they prevent excessive cholesterol production, they also stabilize the endothelium. So in the lining of your arteries or the vasculature, if you take a statin or a cholesterol lowering drug, they usually make it stable, so plaques may not break off, as we discussed, to go and lodge somewhere and cause a stroke or a TIA. The second treatment is we're hitting on the goal of potentially removing the plaque that is already there. Maybe an MRI has shown that all your carotid artery is very narrow inside. It's very narrow because of an excessive buildup of plaque. Then the potential treatment is to undergo a surgical procedure which will be used to remove the plaque, carotid endarterectomy. So that procedure will be used to clean up the plaque in your carotid arteries. And then the second form of treatment, which I think is the easiest one, is to prevent clots from forming. And clots do form from the breaking off of one of these fatty deposits. If a fatty deposit or the interior of your arteries, the lining of the arteries, especially in the neck, if it is full of fatty deposits and against the pressure, one or a tiny plaque breaks off, it is possible that it can cause a clot, whether in the brain or somewhere else, and it will be carried to the brain and cause a stroke. So or a TIA, if it is temporal, and if we can stop that from happening, that is a goal that we need to achieve. So that is the third goal of treatment: prevent clots from happening. We could also think about other situations where we can get clots forming. If we can prevent clots from forming, then obviously we can prevent anything like a stroke or a TIA. And if you have an abnormal heart rhythm, whether it's an AFib or any other form of heart rhythm abnormality, if that is treated, then you are preventing the clot from happening. The most common treatment for that is using an aspirin, and your doctor usually would treat you with either an aspirin or a medication called clopidogrel. Clopidogrel may come under several different brand names. In the United States, it is called Plavix, but potentially called by different names in other places. Usually for about 21 days after the TIA, or as they deem necessary, and that should prevent you from getting another TIA or a stroke. And also, in line with preventing a clot from happening, if you have heart rhythm abnormality, or if you have another risk for clot apart from what we have discussed so far, your provider or doctor may put you also on other anticoagulant medications such as apixaban or rivaroxaban or Eliquis, as we know it in the United States, or Xarelto, or even warfarin, and any other potential anticoagulants that may be deemed necessary by your doctor. So that is the treatment for to prevent clots from happening and thereby prevent a TIA or a full-blown stroke. Lastly, we want to make sure that your blood pressure is under control, because remember, if the pressure is high, if your blood pressure is excessively high, there are several other risks that are elevated, and with higher blood pressure, you get a chance to break off a plaque that will be lodging in the brain, or you get a chance for an aneurysm in the brain or elsewhere. Let's make sure that blood pressure is treated. And in a person with a TIA or a potential stroke, one of the typical medications that are used in blood pressure treatment is an ACE inhibitor, or the medications that last with a prel, lisinoprel and benazepril, all those medications that last ends with a prel. Thanks for watching this video. Don't forget to subscribe if you haven't already subscribed. Click on the comment section and contribute and ask questions as necessary. And beloved, I wish above all things that you prosper and be in health, even as your soul prospers.